The marks weightage. Many confusion regarding this. All say that pre and paraclinical subjects are the most important, but yes, the clinical subjects are also very much important for INICET exam. INICET May 2023, 23 clinical image-based questions and 20 paraclinical and preclinical. 2023 November, 14 from clinical and 12 from pre and paraclinical. Studying the last 6 years of INICET, I found out that there are some short images that is going to come. One is the cadaveric section. INICET is just round the corner, and in this video, we are going to discuss how to prepare for INICET. The main motto for the video and take-home message of the video is to understand एंड एनालाइज द पैटर्न ऑफ INICET एग्जाम स्टैटिस्टिकली, क्योंकि बहुत लोग बोल देते हैं कि मेडिसिन पढ़ने का कोई ज़रूरत नहीं है, बट दैट इज़ वोगस. आई एम गोइंग टू क्लैरिफाई and clear all the myths and doubts you are having regarding this exam. So at first you will have to know the exam pattern, and secret analysis are going to be revealed in this video. So if you are new to my channel, do consider subscribing to my channel, because like this kind of statistical analysis videos, important topics for NEET PG, INICET and FMG are going to come now and then. So do subscribe to my channel. Coming to the basics. Okay, so INICET has 50 questions, 45 minutes, 4 sets each. So you get a time of 54 seconds per question, which is much less compared to the NEET PG, where you get 63 seconds per question. Therefore, there is a time crunch, and there are 4 options with +1 correct and -1 third negative. So the negative marking is also more in case of INICET compared to the NEET PG. That means that you will have to do less number of negatives to get into the top rank or to overcome the crowding that is occurring. So less number of negatives you need to do, and single option correct questions are mostly there. Approximately 80 to 85% of the questions are single correct option questions, but it also has multiple option correct question, true false, reasoning assertion, match the following and arrange in sequence. I give you an example. So this is multiple option correct question. Copper IUCD has been inserted at a certain recommended times to ensure safety and effectiveness. Which of the following timing are the most appropriate for insertion? Up to day 5 to 7 of menstrual cycle, immediately postpartum, within 48 hours after delivery, within 7 days before the expected next menstrual cycle. So you have option 1 2 3 2 3 4 1 2 3 4 1 2 4. So these are very confusing kinds of questions, and it takes a lot of time to solve during the exam hall, and it was a controversial question also, so I am not going into the answer. The marks weightage. Many confusion regarding this. All say that pre and paraclinical subjects are the most important, but yes, the clinical subjects are also very much important for INICET exam. Here you can see I have taken average of past 5 years of INICET, that is 10 papers of INICET. And in this we can see that anatomy has a average marks weightage of 12 questions out of 200. Physiology has 12 questions. Biochemistry a little bit less, 10 questions. In NEET PG it is 13 questions. So some questions from biochemistry are shifted towards anatomy in case of INICET. Pharma has 16 questions, micro has 16 questions, patho has 17 questions, community medicine has a bit number of less questions, 10 questions. Forensic medicine has 9 questions. Eye has 8 questions. ENT has 6 questions. Medicine, those who say that medicine is just an amalgamation of patho, microbiology, and pharmacology, but medicine has the maximum weightage in the INICET, that is 20 questions. So never miss on medicine. Study a concise source of medicine, but never skip it. Surgery has 16 questions, OBGY also 16 questions, and it is very much high yielding 16 questions. Pediatrics has 9 questions, anesthesia 5 questions, derma 5 questions, psychiatry 3 questions, radiology 4, and orthopedic 6. Now see that this marks weightage is not constant like in case of NEET PG. It varies year to year. किसी ईयर में आई से 12 को क्वेश्चंस आ गए थे. लास्ट टाइम इन द INICET in November 2025, only 4 questions came from pediatrics, whereas the average is 9 questions. So थोड़ा इधर उधर होगा, But from this we come to know that the main subjects, so past 10 years total number of questions approximately 120 in anatomy, 121 in physiology. You can see the highest is in medicine, 199 questions came in the last 10 papers of INICET. So मोटा मोटा पता चल रहा है कि प्री एंड पैराक्लिनिकल इज वेरी मच इंपॉर्टेंट. इट हैज 102 questions, so 51% of the question paper is pre and paraclinical subjects, and clinical subjects constitute 49% of the question paper. Here you can see the major subjects. The major subjects have approximately 61. 102 questions come from the pre and paraclinical, and 37 questions come from the minor subjects. So if you study anatomy, biochemistry, physiology, pharmacology, microbiology, pathology, FMT, commed, medicine, surgery, OBGY and pediatrics, 163 questions out of 200 questions is covered. So these all subjects you have to have a good grip on them. If you add I into that, it will be 171 questions. That is 86% of the question paper is being constituted by 13 subjects. So you will have to focus on these subjects in depth when you study and the previous year topics. Coming to image based questions, INICET usually gives classical images, the images that could be searched from the internet. But the INICET image based questions marks weightage is not that much high as compared to the NEET PG, because in NEET PG 2024, 55 to 60% questions were image based questions. But in INICET, let's see, INICET May 2023, 23 clinical image based questions and 20 paraclinical and preclinical. 2023 November, 14 from clinical and 12 from pre and paraclinical. Then it shifted towards the pre and paraclinical more images. In INICET May 2024, 11 from clinical, 17 from pre and paraclinical. November 2024, 14 from clinical, 20 from pre and paraclinical. May 2025, 12 from clinical, 15 from pre and paraclinical. This was the least number of questions were image based questions. Approximately 27 questions were only image based questions. In INICET November 2025, 20 were from clinical and 21 were from pre and paraclinical. So it corroborates with the marks weightage division only. Nowadays, more and more pre and paraclinical questions are being asked. So more weightage for the image based question is also present in the pre and paraclinical. So I give you an example that they directly don't ask what is shown in the image. They have given this image and the CT scan, the 3D CT scan, and they have told to identify the object which has inflicted. So this is a case of last signature, the depressed skull fracture. It can be caused by hammer. So INICET image based questions marks weightage is approximately varies from 14 to 22%. Now you can go through my digital image bank because it has all 19 subjects, 1850 plus high yield images, and all the images which has been asked in previous year questions have been marked as PYQs. So you can go through this, and the link is given in the description box below and pinned comment section. Studying the last 6 years of INICET, I found out that there are some sure shot images that is going to come. One is the cadaveric sections. Two is the radiological images with anatomy question, like they give you a CT or MRI of brain and they tell you to identify the putamen, they tell you to identify the cerebellum. This kind of questions they are asking, or they are telling you to mark the number of rib that is being shown in the image. Two chest x-rays every year it comes. Any anomaly, there could be pneumothorax, there could be pneumonia. This kind of chest x-rays are asked frequently, and like this, two chest x-rays every year at least. 1 to 2 ECG images are given, two mycology images are given, and physiology graph and signal transduction pathways images are given. INICET is a previous year topic based exam, so you can expect 110 to 160 questions directly from the previous year topics of past 10 years of INICET. For this, I have one INICET past 10 years topic list also. And if you are preparing for other exams, you can go for all the three exams, that is NEET PG, INICET and FMGE past 10 years. The INICET past 10 years strike rate was, in INICET November 2024, 151 questions came from that list. In INICET May, slightly bit less, 2025, 110 questions came from that list. And in INICET November 2025, 140 questions came from this list. So all the November questions are also updated in this list. The link is given in the description box below and pinned comment section. Extra topics that you have to study for INICET that are not important for the NEET PG. These are the life cycle of parasites, monoclonal antibodies. At least two questions come in INICET. The biostats is very much important for the INICET. Recent FDA approved drugs 2020 to 2026. Nobel Prize winners in physiology, the recent Nobel Prize winners. Last year only it came. And the recent medical updates, if there is any medical update, new organ is being discovered, like the torus tuberis salivary gland was discovered 2 years back. So if there is any significant medical update, that you have to know for the INICET exam. Now, how to search FDA approved drugs? Just open your Chrome or any browser and type FDA approved drugs and the year you want to search. First is www.fda government website. Click that. Then you will get access. See the active ingredient name and the use. You can click the plus symbol also to get more data regarding the mechanism of action, because the mechanism of action was also asked in INICET in November 2025. Like this, you can get access to FDA approved drugs. And INICET Essentials link is given in my description box below. There you will get access to the life cycles, the monoclonal antibodies, and some of the FDA approved drugs. And it is free for all. So go click the link and have it. And if you are preparing for INICET and NEET PG and FMG, then do join my free Telegram channel and WhatsApp channel, because questions are being posted every day. And if you also want to get this PDF, you will have to join my Telegram channel. That link is also given in the description box below and pinned comment section. So I hope you have understood the funda of INICET exam. And understanding the funda, you have come to know that you will have to practice the previous year topics. You will have to master the rapid revision notes, because PTR weightage strike rate was a bit less in case of INICET November 2025. It was approximately 100 to 110 questions, but the rapid revision note strike rate was approximately 150 to 160 questions. So focus more on the rapid revision notes, solve the past 10 years of INICET, if possible, solve 5 years of NEET PG also and 3 years of FMG also if you are having time, and try to give more and more grand tests and analyze them properly. So I think this is up for today, and now you can see how is NEET PG different from INICET video and what are the most important topics for INICET. So go watch the video now.